Hello, everyone, and welcome to Sacramento County's Public Health COVID-19 Community Forum. Before we get started with tonight's program, I would like to introduce our interpreters, starting with our ASL interpreters, Jordan and Stephen, that will be providing ASL interpretation. So with that, I'm going to introduce and have Angela start off with Mandarin to help community members about the Q&A function that we have tonight that you could put in your questions and how to tap into the interpretation services.
欢迎参加今天晚上的这一个COVID-19 的这个病毒疫苗的论坛讲座。如果你们有问题的话，欢迎你们把问题放到这个 Q&A 上面，然后呢，在这个右下角这边还可以这个选项。那有这个中文同步翻译，那您到时候可以进去，那我将会稍后为您做同步的中文翻译。Thank you.
Thank you, Angela. Next, I have Laura with Hmong interpretation.
Hello, nhớ trong sẽ ta tao này sẽ là mono, trong sẽ này cũng là công bê, lần đó lúc trong sẽ thả cho COVID của chúa, nhớ trong Sacramento County Health mono, giờ hai tiền này xã mua nó lúc trong sẽ thả mono mất chạy được mong là chỉ nên gạt cho hậu cá, nhớ trong đó này đó nhẹ lúc bó, còn nhẹ lúc bó này hai tiền lôm nó một cho họ nên mà li nó xài lùm mong nên thì li họ cũng xài cho lùm mong cho lùm nó nè thế chỉ ta lên đó do hai tiếng này là còn phải được sáu tông nên đầu năm bữa chua start năm bữa chua là xí do hai tiếng này mua lúa đá chi nên sao họ sao tôi được bé nó nên một cho họ chiều này sau này cho lùm đó tất cả bé mà li bé này cho lùm ở trong đó. Thank you.
Thank you, Laura. Next, I have Ahmed with Arabic.
أهلا وسهلا مرحبا بكم في ساكرامنتو كاليفورنيا في هذا اليوم المشرق الخميس. اليوم سوف نتقدم بكل المعلومات الخاصة بكوفيد 19 اللي هو المرض الوبائي، وسوف نتحدث معكم. أولا سنقدم المتحدثين، ثم بعد ذلك نقوم بالإجابة على كافة الأسئلة لديكم، فتستطيعوا تقديم أسئلتكم بالضغط على الزر في أسفل الشاشة، وسوف يسرنا أن نجيب على كافة أسئلتكم. ونرجو أن تكون هذه الندوة أو المؤتمر مفيد لشرح كافة الأسئلة وكافة المسائل الخاصة بهذا الوباء، وأنا يسرني أن أكون بالقيام بالترجمة. واسمي أحمد مخيمر. ألف شكر. سلام.
Thank you. Next, I have Tam with Vietnamese.
Xin chào mừng quý vị tới diễn đàn cộng đồng về COVID-19 được tổ chức bởi Cơ quan Y tế Công cộng quận Sacramento. Để sử dụng dịch vụ thông dịch, xin quý vị làm ơn bấm vào biểu tượng quả cầu ở phía dưới màn hình Zoom của quý vị và chọn tiếng Việt, tức là Vietnamese. Để đặt câu hỏi cho phần hỏi đáp, xin làm ơn bấm vào nút Q và A, tức là cũng ở phía dưới màn hình của quý vị, và đánh vào câu hỏi của quý vị. Xin cảm ơn quý vị. Thank you, Mike.
Thank you. And next we have Alexander with our Russian interpretation.
Здравствуйте, добрый вечер и добро пожаловать на сегодняшнее собрание общественности в округе Сакраменто, посвященное пандемии COVID-19 коронавируса в округе Сакраменто. К вашим услугам услуги переводчика. Пожалуйста, выберите соответствующий язык. Если вы желаете задать вопрос и получить ответ, используйте раздел Q&A для того, чтобы напечатать ваш вопрос, и ваш вопрос будет задан, и на него будет дан ответ. Желаем вам приятного прослушивания.
Thank you, Alexander. Next, we have Miguel with Tagalog.
Hello, malugod na pagtanggap sa bawat isa sa inyo. Salamat sa inyong pagdalo dito sa ating usaping pangmamamayan. Ito po ang kalusugan ng lalawigan ng Sacramento na pagtitipon tungkol po dito sa COVID-19. At gusto po ninyong i-access yung po Tagalog, puntahan lamang po yung litra po dyan po sa ibaba. Pagkatapos po ay huwag po ninyong kalilimutan doon po sa kwarto na kung saan ay maaari po kayo makipag-ugnayan. Pakisumite lamang po ang inyong mga tanong doon po sa Tapalodo. Tsaka sasagutin po kayo dyan. At ang atin po mga magsasalita ngayon ay mga eksperto na mga manggagamot. Salamat po muli sa inyong pakikisama sa amin.
Thank you. And next, and finally, we have Frida with Spanish.
Buenas tardes a todos y bienvenidos a este diálogo comunitario del COVID-19 realizado por el Departamento de Salud Pública del Condado de Sacramento. Gracias por acompañarnos. A efecto de proporcionar acceso lingüístico, esta reunión va a contar con interpretación simultánea bidireccional al español. Si usted desea acceder a la interpretación y está en su computadora, en unos segundos haga clic en el icono en forma de globo que está en la parte inferior de su pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Si usted está en su iPad, su teléfono o un dispositivo celular, en unos segundos localice el menú de 3 puntos que está en una de las esquinas de su pantalla, haga clic en interpretación de idiomas y después seleccione español o Spanish. Y si desea formular alguna pregunta o comentario, por favor pónganlo en la sección de preguntas y respuestas o Q&A que encontrará en la parte inferior de su pantalla. Gracias. Thank you, Mike.
Thank you, Frida. And now I'm going to have interpreters assigned to your room. So please enter your room and unmute. Again, community members, please utilize the interpretation services if needed. And again, gentle reminder, we have the Q&A function box. Please put any questions you may have for the evening. With that said, I'm going to, I have the privilege to introduce my fellow colleagues that will be hosting and speaking for tonight's community forum. If I could have you all turn on your screen and unmute yourself. I'm going to have you all introduce yourselves. I guess I'm gonna start with Rachel Allen, our immunization coordinator.
Hi, thank you. Good evening. Happy to be back. I think I missed a week, a couple weeks ago. So I can update you on what's happening with our vaccination program. And usually I start off by telling you how many vaccines were actually allocated to our county for next week. But this week we had a first where the state recognized that counties really have quite a bit of vaccine on hand. And so they did not allocate vaccine to counties. Instead, they are encouraging that we redistribute within our own provider network. It's something we've been doing anyway. And just to make sure everyone has what they need. And we could order vaccines if we needed them, but I think for Sacramento County, we're doing okay. So my program does stay busy moving vaccine and redistributing vaccine to make sure that all providers have what they need, whether it's Pfizer or Moderna or Johnson & Johnson. And I think since the last time I was here, of course, we've had the change where we can now vaccinate all persons 12 years of age and older. So that's very exciting. And of course, only Pfizer for kids ages 12 to 17 right now. So we've been working hard to make sure that Pfizer vaccine is available to physician offices and providers, to a lot of our pop-ups. We take them to our pop-ups, and also to pediatricians and those who care for children, really wanting to make sure that that vaccine is accessible to those practices. And so we are also, I think we've discussed in the past, kind of moving away from that mass vaccination plan, which was our early plan and very effective in getting a lot of people vaccinated. But now we're really moving into that need to be in the community, to have vaccines accessible to people who have transportation or other barriers, and to make sure that it's also convenient for people. So I'm not sure if you've seen in the news, we have a lot of different things going on. Some of the mass vac sites are still operating, of course. But some of the efforts that we've been involved in are going out into the community. This week, we've been in Rio Linda, down in Isleton at the Asian Resources Center. And you may have seen the trailers that we have. We were able to obtain 2 response trailers. And so we do take those to some events, and it really makes it nice for the team that's working there. And then we've been out with schools. We're working with all of our health systems, and actually all of our health systems are working together, which is just really awesome, to get out and do some larger vaccine clinics for the schools, and trying to get those junior high and high school age kids. So Hiram Johnson was last week. Yesterday we were at Luther Burbank. Next week it's at John F. Kennedy's. So continuing those efforts as well. So keep an eye out in case there's something coming to a school near you. And then my team does continue also to work with people who are experiencing homelessness. So we have teams that go out both to sheltered and unsheltered persons, and offering multiple vaccine types so that people have options and don't feel like they have to just take one that's offered. And really trying to make, again, it convenient and accessible, and be able to answer questions and make sure they have information that they need to be able to make that decision. And we do also serve homebound. So that's another big project. We get lists of patients that are indicate when they go to make an appointment on My Turn that they are not able to leave their home. We also get people who call in and various other referrals, and we combine those, and we have a team that goes out and does those. And we also work with some pharmacy partners. And so that's an important aspect, and we're going to continue to do that. And so our website is still the best place to find, and I was just looking to find where you can get an appointment, and there's just all kinds of places that you can go, including pharmacies who many are taking walk-ups. So if you're struggling to make an appointment, you can try walking into a pharmacy and getting an appointment. But the other thing that's on our website that I'm really proud of is when you pull up our dashboard that shows how many doses have been administered. So it's only updated on Fridays. So this is from last Friday, but it shows 1,245,207 doses administered. So, here it is. Yeah. So I think our team knows a lot what has gone in to make that happen. And I just want to say how grateful I am for all of the providers in Sacramento County, whether it's the health systems, small medical offices, pharmacies, everyone who has stepped up, worked long hours, and really done it from the bottom of their heart, and for the care that they have for our community to make sure that these vaccines have been out there. So you can see that we show partial vaccinations and full vaccinations. So we continue to follow up on people who have not gotten their second dose. So we want to make sure that people are continuing to complete that series. So for Moderna and Pfizer, making sure you get in to get that second dose. And we have some really fun things that we're working on too. And I might save those for my colleague, Nick, but again, you may have seen in the news other places doing some fun events to try to draw in people. And so you'll see some of those coming our way as well. So I'll turn it over to Nick.
Hi, everyone. Nick Murray with Sacramento County Public Health. A little bit of a change of role for me as I've been in the host chair a couple of times. Dr. Kasirye sends her regrets. Unfortunately, she had another commitment, and I was going to joke that I drew the short straw, but I think you all may have done the short straw as I'm filling in for her. So Dr. Cohen, we may be leaning heavily on you for some of the medical questions tonight, but I want to start with a quick update of the numbers. So as of this morning's dashboard update, we have 106,153 total cases in Sacramento County. That's cumulatively since this all started. 110 new cases added today, 1,707 total deaths, and that's an addition of 5 new deaths with today's update. So as you'll note on the display there, we had a pretty good decline after the holidays in the early part of this year, and then we really stalled out, and that's why we've been in the red tier on the state's blueprint for a safer economy for really a couple of months here, holding steady, and we finally started to see a decline in the last couple of weeks. With earlier this week, for the first time, we met the criteria for the orange tier on the blueprint. So that's very exciting. And if we do meet the criteria again this coming Tuesday on June 1st, we would officially move into the orange tier. And so as I'm sure many of you are aware, the blueprint is going to be retired shortly. So you might ask yourself, well, what's the big deal then? But I think, at the end of the day, ultimately the tiers are determined by our case rates and, the prevalence of COVID-19 here in Sacramento County. And so that is great news because that is an indication that we are moving in the right direction after those couple of months of being stalled out. So again, assuming that we do meet that criteria Tuesday, we would move to the orange tier, which generally speaking means a lot of the same activities would be allowed that are currently allowed, but with greater capacity. So whereas you might currently have a restriction of 25% capacity, for instance, I believe in restaurants, it would move to 50%. And so you would see that across the board for many of the business sectors that are currently affected by the Blueprint for a Safer Economy. We would also update our local health order to align with that. And then again, on June 15th, the exciting news is that that is the blueprint, beyond the blueprint for a safer economy, meaning that the blueprint itself will be retired. So there will no longer be colored tiers that determine restrictions, and we will largely see the elimination of most of the restrictions that are currently in place. So at that time, our local health order would expire, would be lifted. The state health order would also be lifted. We do expect the state declaration of an emergency to remain in place. I think at least for a few more months, although I don't know that they've indicated exactly how long. And there would be some level of guidance and restrictions on some larger events, what the state is deeming mega events. So for an indoor event, that would be an attendance of 5,000 or greater. For an outdoor event, attendance of 10,000 or greater. And in those cases, for the indoor events, the state would still require either testing prior to admission or proof of vaccination for those indoor mega events. And they would strongly recommend it for the outdoor mega events. And we expect those restrictions on the mega events to stay in place at least until October 1st. At that time, we also expect the state to update their masking guidance to align with CDC guidance. As I'm sure many are aware, the CDC made some changes recently, indicating that those who are fully vaccinated, meaning they're at least 2 weeks post final dose of their series, would no longer need to wear face coverings once they're fully vaccinated, even in public. And the state of California held off on making that change. That's partially to allow a little more time for messaging on that, because when CDC came out with that, it was a little bit abrupt, and I think folks weren't quite sure what to do with it. And also it's partially to allow us a little bit more time to get more folks vaccinated. Obviously, if only half the population is vaccinated, it gets a little bit challenging figuring out who needs to be wearing a face covering and who doesn't. So vaccination efforts continue, as Rachel talked about. Our strategies have changed more recently, and we do have some exciting events coming up. We're trying to get more and more creative in how we set up events. And as she said, we are setting up smaller events in different communities. But what we're also doing, we're excited that we're just able to announce a partnership with the Republic FC soccer team. And starting this Saturday, we will be starting a series of promotions with them that we expect to go throughout the summer. But this Saturday, and again next Wednesday and the following Saturday, all three of those matches will be hosting on-site vaccination clinics at the stadium prior to the game. And the Republic has generously offered to allow free admission for those getting vaccinated on site. So we're very excited for that. As you might imagine, that is limited availability. They don't have unlimited ability to let everybody in, but there is the ability to pre-register for that. And I checked right before this, and there is still availability. They're currently allowing registration for that for this Saturday's match. So very excited about that. We're also working with some other partners on some other ways of trying to promote vaccination in places of business, and also help promote small businesses here in Sacramento County. And we're excited to have some new announcements about that in the near future. We're also engaging in some efforts to try to work with business owners who may have employees that need vaccination, and potentially bringing clinics to them. And I think one other thing, as many of us learned today, the state of California also announced some pretty juicy incentives for vaccination, including anyone who is vaccinated being entered into, I don't know what the legal term they're using to make this all sound good, but essentially a drawing for a chance to win a pretty good chunk of money, and also some additional incentives for the next couple of million people who get vaccinated in the state. So similar to what we've seen some other states do to really try to drive up vaccination rates. So I think I'll stop there and see if Dr. Cohen has anything to add.
Yeah, so I'm Stuart Cohen. I'm the Chief of Infectious Diseases over at UC Davis Health across the street. And I've been involved for the last several months with this discussion in relationship to some of the more medical issues of vaccine, and also to give people a little bit of a perspective as to what's happening in the healthcare facilities beyond what gets reported to Sacramento County. So we are still seeing a bit of a plateau in the number of cases that we have over in the hospital. It seems to be going down, and then it creeps back up again a little bit and goes down a little bit. Our positivity rate of testing is probably somewhere around 3%, which is definitely higher than the state as a whole. It's a nice thing that we are finally making it out of the red tier, but a lot of the other counties have already made it to yellow, and Sacramento County seems to be a little bit behind. And some of that has to do with vaccine rates. And so we also are spending a lot of time trying to figure out strategies to get people interested in getting vaccinated. You know, we started out when the first time I was asked to be on this panel. I think Rachel spent a lot of time trying to calm people down that there was going to be enough vaccine and that everyone would be able to get vaccinated. And now all of us have plenty of vaccine. We have way more vaccine than we have people wanting to get vaccinated. And I think I look at participating in these as a way of trying to also address some of the medical concerns that people have when they're vaccine hesitant, because ultimately that is the most important thing in getting this pandemic behind. And when people talk about herd immunity, I know people have said we're never going to reach it, and there are all these other things, but I just want to point out that we have high-risk people in our population. We see them all the time in the hospital. Patients with malignancies, patients with bone marrow transplantation, patients with organ transplantation, who even after they get vaccinated, a significant percentage of them don't develop immune responses. And so this about, that's where herd immunity should really be important, as opposed to saying, I can get by without getting vaccinated because everybody else is going to get vaccinated. There are people in the population who are just never going to be immune, no matter what we do, no matter how many doses of vaccine they get or how many types of vaccines they get. And so I really am very committed to getting all of our people within the health system vaccinated, and all of our patients. And I think there are a number of people within our school who are also doing outreach to varying communities. And we're all talking about clever ways to get people interested. You know, sometimes people can't get off work, bringing vaccine to where they work, and or on these little vans or something like that may also provide a lot more opportunity for people to get vaccinated. Anyhow, I won't go on and on. I think this is a great session. I'm glad there's still a significant number of people that want to participate. I think 2 weeks ago when we did this, we actually asked the participants whether these have been helpful, and it was pretty uniform that people wanted to keep going. So I hope we can provide you some information today that you can bring back to your friends and family as well.
Thank you, Dr. Cohen. That's a perfect transition into our first question. As you're speaking of creative and innovative ideas of increasing vaccination efforts. So I guess the first question that a community member asks is, what specific plans do Sacramento County have to do effective outreach to community members? Maybe larger apartment complexes, central areas, night weekends, are those in the planning process? And I guess I could take this one.
Sure,
Or
yeah, go ahead, Mike. You're the most knowledgeable.
Yes, I guess in terms of this one, we are working really diligently with different community partners, including finding ways to partner with apartment complexes, utilizing and tapping into our resources to really reach out to underserved communities and other communities, especially those that have vaccine hesitancy. Again, we are leveraging our community-based organization and faith-based organization, along with other trusted messengers, to really increase these vaccination efforts. So these are some creative ideas, and we are in the midst and planning those.
I'll add to that. I think the question asked about a very specific neighborhood and zip code, and I believe we are actually working with an apartment complex attempting to put together an event in that very zip code. So.
And I would add something too. So if you know of a community or a neighborhood that you think is lacking or would benefit from us coming, please let us know. We have a form that you can complete, or you can email our COVID-19 vaccine inbox, and we'll direct it to the right people. But we're happy to go out and do, if we do 50, 60 vaccines, 40 vaccines, we're happy to come. It's really important that we do it. And if you know of an area that you think has been missed or would benefit, please let us know.
Another community member asks, should someone with a higher than normal red blood cell count and low blood oxygen wear a mask for an extended period?
Yeah, I'm not sure that I totally understand it. So I think the people who are really at risk for more severe disease and who probably should continue to wear masks are people who have low white blood cell counts. People who have chronic lung disease and have low oxygen sometimes have a higher than normal red cell count, because that's how your body compensates for the low oxygen. I think obviously somebody who's got underlying lung disease, if they get COVID-19, would have a more severe outcome. And so it seems to me that might be a reasonable thing as well. But somebody like that should respond well to the vaccine. And once you're vaccinated, the chances that you end up getting severe disease is pretty darn low, but it's not zero. And I think there are a couple of other questions that we'll get to that may address some of that.
Another community member asks, how are breakthrough cases being defined? It seems like there's considered a breakthrough if someone tests positive, but if there's no symptoms, isn't that showing that the vaccine is doing its job? And I guess there's a follow-up questions. If someone is exposed, wouldn't there have to be a virus in the body for the antibodies to work?
So can you say that again, Mike? You cut out a little bit.
Yes, I apologize. So the first question, how are breakthrough cases being defined?
Yeah, so breakthroughs are being defined as somebody who tests positive 2 weeks after they've received either the second dose of the Pfizer or Moderna vaccine or their 1 dose of the J&J vaccine. And the initial data for breakthrough cases was reported by CDC in one of their publications called the Morbidity and Mortality Weekly Report on earlier this week, I think yesterday or the day before, although it's dated for tomorrow. And it goes through all the cases that were reported, which is over 10,000 cases. And in that group, 27% were asymptomatic. So it wasn't all asymptomatics. Because the numbers started going up to a reasonable amount, they actually switched over to talking about hospitalized patients or people who've died after they've been vaccinated. And so let me just point out a couple of things. So we talked and have talked in the past about variants accounting for potentially some of the vaccine breakthroughs. They don't have all the positives defined as to variants, but there are at least, I think they said about 5% of the reported cases were tested for variants, and 2/3 of those ended up being one of the variants that have broken through with the vaccine. So again, that as a message, that is, the more people who get infected, the more likely there are to be variants. So if you get the vaccines rolling out, you don't see the variants, you're going to see less breakthroughs. They did end up switching towards the middle of April or something, where the numbers had gone up high enough that they didn't want to keep measuring all the cases. And so they only look at hospitalized patients and fatal cases, of which there have been almost 2,000. There have been 1,800 hospitalizations and about 350 deaths. And of some of the hospitalizations where people are asymptomatic that were hospitalized for something else, and they ended up just getting a nasal swab when they were admitted to the hospital. So so out of whatever 12 or 13 million people that have been vaccinated, that's a pretty darn small number, but it isn't zero. And we don't have clear data on individual patients as to why somebody got infected and what their risks are. But I also saw a question in here, and I'll address one more, and then I'll be quiet for a minute or so. But I think there was a question about dialysis and the testing to determine whether somebody actually had antibodies. And the tests that we have that are generally available will tell you whether you have antibodies or whether you don't. They don't tell you how much, and so we don't know whether it actually gets to a threshold where people are actively protected. But what we do know is if that test is negative, you're probably not protected, or at least you should assume you're not. And I think, and so if the test doesn't work very well in dialysis patients, it may well be because those dialysis patients, based on their immune systems not being quite as good as it was before, can't really develop antibodies and can't really be protected. And again, that was the whole point of the earlier comments regarding herd immunity. So the way you protect the dialysis patients that don't develop antibodies is for everybody else to be protected and to stop spreading SARS-CoV-2 in the community. Very long answers. I hope they're understandable. If not, ask again. I'll try again.
Thank you, Dr. Cohen. A question, another community member asked, do we have mega events in Sacramento County?
So yeah, I can take this one. So generally, again, mega events by the state's definition will be an indoor event of 5,000 or greater, or an outdoor event of 10,000 people or greater. So I think some examples of that, I know some of the cities are planning some big 4th of July celebrations. Those generally are outdoors, but some of them may be approaching that size. So those would be considered a mega event potentially. Obviously, we have the Golden One Center in downtown that I believe has a capacity of almost 20,000. And so that being an indoor facility, I think it's very likely that they at some point will start bringing events back that would surpass that 5,000 number. I was actually just looking at their calendar recently, and it looks like they don't have anything scheduled, I don't think, until August. I think it's the Harry Styles concert, if I remember correctly. But then you'll start to see some more concerts there. And then again, when basketball season resumes. And then of course we have the convention center, which has the capacity to hold large crowds as well. So we may start to see things like that. Also Cal Expo, which is currently being used as a mass vaccination site, but we may see that transition back to its originally intended use and hosting events. So I believe they've expressed intentions to maybe later this year still hold the state fair. So that would probably be potentially a mega event. And then the events that they tend to host at that facility, like home and garden shows, those types of things could potentially also meet that criteria.
Thank you, Nick. Would the county still have the dashboard up after June 15th?
I think we've had some conversations about that, and I think it's undecided. I do believe it will stay up for a while. It may not be updated as frequently. Am I remembering correctly, Nick? We did have a discussion about it. I think, like I said, undecided, but I think if it continues to be updated, it will likely not be updated daily like it is right now.
Thank you. Are there any threads emerging about the vaccine breakthrough cases, ages, length of exposure, type of vaccines, etc.?
Yeah, I think we know that people are, the average age is about 58. The majority of the patients are over 40. Of the people who are hospitalized, the average age, I believe, is over 65. And or at least most of them are over 65. We don't know which vaccines they received, so that granularity is not there as far as nor do we have exposures, right? Because these are just reported cases that come through the health departments locally to the state and then to CDC. And so no one's had a chance to really go through the major details about exposures and otherwise. I think it's about 50-50 men and women. And I guess I can leave it at that.
Can you please speak to what masking recommendation will look like for children, especially under 12 years old, over the summer and also into the new school year this fall?
So we expect CDPH guidance to be updated around the time where we move beyond the blueprint, and we expect it to align with CDC guidance. So that gives us a pretty good clue what it would look like. And generally that guidance is in terms of vaccinated versus unvaccinated. So at this time, of course, we know that under 12 are not eligible to be vaccinated because no vaccine has been approved for that age group. So I would expect the guidance generally to remain the same for that age group as long as they're not able to get vaccinated. I know there are some questions about what will the school year look like next year. And again, we expect CDPH to issue updated guidance for schools once CDC issues theirs. I know they've been in close communication with CDC. They want to make sure that when they do come out with updated guidance that it aligns so we don't end up with confusion of, CDC says this and CDPH says that. So we do expect that hopefully early this summer. In the meantime, CDPH has said that schools should continue to follow their existing K-12 guidance, which does require the use of face coverings on campuses by both staff and by students. I think it's still not entirely clear what the face covering guidance for schools will look like for the fall. But again, very unlikely that we will see vaccination in that 12 or under 12 population. So I would, if I were a betting person, I would probably have my money on some level of mask requirements for that age group. It still remains to be seen if they will differentiate the guidance based on age, or if they'll go for a one-size-fits-all approach. So more to come on that.
Thank you. And Nick, I know that you mentioned this earlier, but again, a community member asked, what is the possibility that Sac County will meet the orange tier next week?
Yeah, so it's looking pretty promising that we will move to orange on Tuesday, June 1st. Nothing is for sure, but we did meet the criteria for the orange tier this week. And the state does require us to meet the criteria 2 consecutive weeks in order to do so. And based on the numbers we've been seeing, it's looking pretty good. So if in fact that does happen, we will have an updated health order that instructs residents to abide by all of the orange tier restrictions on the blueprint.
Thank you. Another community member asks, how much are you using the Johnson vaccine compared to the other 2 when giving it out to community?
So we're always taking Johnson & Johnson, and then right now we're taking Pfizer to most of our pop-ups as well, because of course we're trying to capture those 12 and up, but it varies by clinic. I would say there's often quite a bit of interest in Johnson & Johnson. Sometimes it's a little bit more J&J and a little bit less Pfizer. Some clinics it's a little more than half Pfizer, and it changes. But we're committed to taking them both out to make sure people have options. And we had been doing all of our pop-ups with Johnson & Johnson because it's of course more convenient not to have someone come back for a second dose. But we do want to make sure that if someone does not feel comfortable or they feel like the risk is too great for them, we want there to be an option for them. So we're taking both, and we'll continue to do so for the near future.
Thank you. Do we have a significant number of cases due to the variants? And what are the existing variants in our county?
So it's not a huge number, but first of all, within California as a state, the B117, the so-called British or United Kingdom variant, is now the predominant strain in the state of California. There are about 250 that have been identified in Sacramento County, which is the most of any of the variants. There are 2 others that are so-called California variants that are right behind. There have been very few of the South African and very few of the Indian variants, but they've all been seen here. So the numbers are really small right now. It's not clear how many of the actual COVID-19 strains are being looked at to determine whether they have variants or not. But all the variants exist here. The one that's the biggest one is the British one. That is going to be the predominant variant in the United States. If it isn't already, it will be. And it's the same here. The other ones are taking longer for uptake, which is a good thing.
There's a few questions about boosters. So first, are any thoughts for boosters later in the year? And if so, what is the anticipated time frame for this booster?
So I guess I can take that too, to a degree. I think what we know, so let's start with what we know. We know that immunity with natural infection lasts at least a year, or at least it looks that way. There was just a paper published yesterday that went out to a year and showed that there was significant immunity. We also know from data with Pfizer and Moderna that antibodies are present at least for 6 months afterwards, although they're a little bit lower at 6 months than they were at the beginning. And the efficacy, for example, of the Pfizer vaccine goes from 95% to about 91.5%. So it stays very effective. Whether we are going to need boosters immediately or not, I've said this on several of these town halls before. I'm optimistic. I don't think we will, because I think that as the case numbers go down, the variants will not be widely circulating, and it will probably not be this fall that people will have to get booster doses. We will at some point in time. I don't know what the timeline is going to be. I can't predict. I've been saying from the beginning that I think it would be probably every 2 or 3 years, but I don't know whether that's true or false. I think if we get vaccine rates up, I don't think we're going to all be lining up in October to get vaccinated again. That's one person's opinion.
Another community member asks, with the amount of air traveling or people traveling in general, how might variants expand within the county?
Can you say that again, Mike?
Yes. So with the increase in traveling in general, how might variants expand within the county?
Yeah, well, again, you know, if people are vaccinated and those who are not vaccinated are masking as still is required on airplanes, I think, you know, knock on wood, I don't think it's going to be a huge influx. But obviously that's where these things came from, right? All the variants that we have didn't spontaneously develop here in the state, except for those so-called California variants. And even then they started in Southern California and made their way up here.
Going back to the creative clinics, are we able to set up clinics at places like the Social Security office or the DMV?
Sure. We did a few last week, actually, at the Department of Human Assistance, several locations. So we are open to all places that we can vaccinate people that are safe for us to come. So there has to be just enough space for us to socially distance patients and be able to operate. But we're open. We want to be creative. So yes, we would do that. And we'll continue to go to places like that.
Rachel, is it true that the monitoring period that's normally 15 minutes is actually 3 hours if we do it at the DMV?
That's not a bad idea. We could vaccinate and then put them in the line and watch them.
Another community member asks, who is monitoring the COVID rate after June 15th? Are death and infection rates still being reported after this date?
I'll take a stab and then feel free to jump in, everybody. So yeah, I don't expect any changes in how we monitor cases. They will still be reported by labs, any physician's offices, anybody performing tests. We would still have the same level of monitoring in our office. So I wouldn't expect any significant changes on that front. I think if anything, it would be just as important for us to continue doing so as we see more and more things open up. Obviously, we want to make sure that that's not having a detrimental effect on our disease burden. So I think things will be status quo for the most part.
When should we expect Cal OSHA to issue a guidance?
So I don't know that we have a definitive timeline from them. I think we've been hearing rumblings that another update should be coming soon. We did run into an issue earlier this spring where the CDC had updated some guidance with regards to quarantine requirements for quarantine not being necessary for individuals who were fully vaccinated, who were a known close contact of somebody who was positive for COVID-19. And the Cal OSHA requirements were not in alignment, which created some confusion for employers. And so I think there is a newfound effort at the state level to try to have the Cal OSHA requirements keep up with the ever-changing public health guidance, but I don't have a definitive timeline for when the next update will be.
Yeah, I was actually told that the update for the hospitals might be available even tomorrow, but I think the general rule of thumb is Cal OSHA has always been more conservative than pretty much any other organization, and I think the idea of trying to get everything aligned so people don't get confused is a really important thing, and at least for hospitals, Cal OSHA already has what we call the airborne or aerosol transmissible disease guidance that basically has a category for novel viruses. So there really isn't necessarily the need for a bunch of extra stuff because it's already within the document. And so I'm interested to see how they're going to approach this too, because I think there's a lot of interest, I'm sure, in all businesses, just as in healthcare, that, I've been vaccinated. I was told I could be in a room with people without a mask if I'm at home, but I can't be at work, right? Because that's where the sad faces come up on the CDC mask guidance as opposed to the happy faces. And so I think that's the challenge. We'll see what happens.
Another question is, I'm going to rephrase this. Are there common characteristics among COVID patients that have been noted within our county, including at UC Davis Medical Center, such as age, cultural backgrounds, familiar community relationship, socioeconomic status, etc.?
So I don't have a ton of detailed data from Davis, but I have some. So early on, patients were older. Now they're younger. So I think if you look at where the target is, it's probably in the 40-year-old range is probably the biggest number of people. I think it's been, like I say, about 50-50 men and women. And I think that as far as race and ethnicity goes, I think the majority of the patients that we're seeing are still white. But I think probably less than the percentage of white people in Sacramento County. And there's probably still overrepresentation of the Latino population, the African-American population, and some of the Asian Pacific Island groups. Early on, we had a lot of patients from the Marshall Islands. And I think that's the one thread that seems to be sort of the case, is that there are a lot of family clusters and there are a lot of social events that have accounted for a lot of the patients and a lot of the transmission, at least at UCD, and same with our healthcare workers that have been infected. Almost nobody has been infected in the hospital. They've all been infected at home, and probably in relationship to social gatherings. I don't know if you have better or different data from the county.
Probably neither better nor different, but I just wanted to share that our dashboard does have a demographic tab that will give you information on cases by age, sex, and ethnicity, and it also does the same for deaths. So give you a little bit for countywide there, if folks want to check that out.
I will put that in the chat again for the dashboard. Thank you, Nick. Another community member asks, is there any guidance for the annual breast cancer 5K walk at the Capitol? That normally has 20,000 plus attendees in October during Breast Cancer Awareness Month.
So that sounds like that would fall under the mega event guidance. So the state does have that on their website, and one of the main tenets of the mega events for outdoors is that they would strongly recommend that individuals participating either be fully vaccinated or get tested immediately prior to the event. And of course, they would want to exclude any participants who tested positive or who were exhibiting symptoms. And then they include some other guidance with that, just considerations for event planning to try to manage that size of a crowd and try to minimize the likelihood of having COVID transmission on site.
Another community member states, I'm allergic to all the vaccine, and there's a small study that indicated the TB vaccine might be protective. Is this something that is recommended?
No, not really. So the TB vaccine is what's called BCG. It is a cow tuberculosis that has been weakened. That's used mostly outside the United States in countries where there's a lot more TB. But it also will boost a bit of an immune response. In the US, it's sometimes used to treat bladder cancer because it causes an immune response that may actually kill some of the cancer cells. It's directly placed in the bladder. So I'm assuming that part of the argument is that it's just a general immune stimulant. I'm not sure what how you're allergic to all the vaccines though. And I think that may be something that would be worth discussing with your healthcare provider to try to clarify what the allergies are and why it would be okay to take another, an alternative vaccine, which is also based on a live microorganism. In fact, it is live, as opposed to these other vaccines, which are not.
Trina asks, why does a person have to wait 6 weeks after the vaccination before getting an x-ray?
I don't think they do. And so I'm not sure who told you that or how that came up, but there's no reason that you would have to wait. If you need x-rays, you need x-rays. And you get your medical care done. The vaccine shouldn't interfere with that. Right, if you're taking a 2-dose vaccine, like the Moderna vaccine, that would mean that you couldn't get an X-ray for almost 3 months after your first dose of vaccine. That doesn't make any sense.
Another community member asks, after June 15, are stores and businesses allowed to have their own more restrictive masking policies?
That's probably a question for the attorneys, but I don't think that we see any reason why they couldn't do that if they wanted to.
Another community member asks, what percentage of UC Davis employees are fully vaccinated? And what is the percentage of Sacramento County employees? are fully vaccinated?
So I don't have all the data from Davis, but I do have some, and I guess no one will get mad at me if I say. And so we don't know 100% because of the info, because if people get vaccinated at their own doctors, because it's not mandatory, we don't make them report it. But what we know is within our system, people who've got vaccinated by us, it's about 75% of our employees. It's almost 90% of the physicians. There are other groups that have lower percentages that bring the numbers down. And we're working on that too. 10% of docs, I don't get that either. And so we are trying internally as well as we are externally to get everybody vaccinated.
Rachel, you want to try?
Yeah, I can take a stab too. So I don't have exact data either. And that, Sacramento County, that encompasses a lot of employees of various types of work. But I will also take a venture to say that those of us who work on COVID response in public health are very close to 100%, if not 100% vaccinated. We all truly believe in what we're doing. We want to be protected, and we want to protect our families and our community members.
I heard that UCLA developed an anti-allergy cocktail for people with severe allergies before getting vaccinated. Is this true?
I would not be surprised. I don't know this for a fact. I can surely find out. We have meetings of all the University of California infection prevention people weekly. So I could surely find that out, and by the next one of these discussions, I can have that. I suspect that it's a combination of something like Benadryl and other kinds of things. I don't think you want to give steroids or anything like that, because it may actually blunt the vaccine response. So I will see what they have put together. I can picture that does exist.
Okay, are there any guidance for children under 12? What would be the safest activity over summer recommended for children and youth?
So, I mean, I think you can certainly take a cue from the guidance that we've seen for school settings, and probably just apply a little bit of common sense in terms of what we've learned over the past 16 months about COVID-19. I mean, obviously, generally outdoors is going to be better than indoors. Since this is an unvaccinated population, if they're going to be in proximity with other students or teachers or counselors or whatever, it'd be a good idea to have them masked. The question mentioned sports specifically. I will say that when this spring, when sports were again allowed in school settings, we did see quite a few cases and outbreaks related to youth sports. And I think it's probably safe to say that probably constituted the majority of our school-related cases that our teams were responding to. And I think that's just a function of close proximity, probably not very good mask usage, even though that's what the guidance called for. And then there are other factors that go along with that, right? Even if during an activity, everybody is abiding by the guidance, if we all go have pizza together afterwards or have a slumber party, that pretty much nullifies whatever we were doing during the organized function, and Rachel's cat's climbing the wall. So I think just taking all those factors into consideration in terms of planning things out. If you are looking at organized activities like camps or other things like that, I mean, you can kind of fall back on the concept of stable groups, and obviously, if they're with the same individuals every day, that's generally going to be considered lower risk than if they're with a different group of people every day. Just kind of playing the odds game there.
Thank you, Nick. When will the new clinical trial Noel vaccine be in third stage trials be approved?
Yeah, so I think that's the Novavax vaccine, which we are doing studies. And in fact, I got pages and pages of stuff to sign every day for this. I think the goal is to have this submitted to the FDA in about somewhere towards the end of June, at the latest, the beginning of July. I haven't seen any of the data yet, but as with all the other trials, they've enrolled 30,000 people. And I think it's really important to get the EUA done, because I think a lot of people are getting a little anxious. They volunteered to be in a clinical trial to help get these vaccines approved. And now when they have to get a card to show, to say that I've been vaccinated, if there is a, if they're getting on an airplane or if they're traveling to certain countries, they have to show vaccine, that they've been vaccinated. Everybody in that trial has been vaccinated at this point. So it was placebo control. 2 got drug for every one that got placebo. And then over the last month or so, we vaccinated everybody that had placebo. So everyone in that trial has been vaccinated. They all should be able to get the same cards, and they need that FDA approval, or else they're going to end up getting more vaccines that they may not need, because they just need to have documentation. And so all of the investigators, we have been pushing as hard as we can push to get all this stuff done. But there is a lot of stuff to collect. As I say, I don't think you can see very closely how many of these little tabs there are for me to sign. But I get these like twice or 3 times a day, every day. And it just is a lot of information to get done, to get everything prepared to get to the FDA. Very long answer, hopefully within a month.
So I guess there's 2 questions, follow-up questions for that. Is there a need for another approved vaccine? And then speaking of FDA approval, do we have a timeline when and where the full approval rather than the EUA?
Yeah, so the second part, I think Pfizer's already going to be putting in for full approval, and probably will get that sometime in the next couple of months. As far as whether there's a need for another approved vaccine or not at this point, I think probably not so much in the United States anymore, because there's plenty of vaccine available. But there are people who are anxious about some of the newer technology that was used to develop the Pfizer and Moderna vaccine. And at least this Novavax vaccine is a more traditional type vaccine. It's built just like the shingles vaccine is built. And so some people may be more comfortable. That may improve some of the hesitancy that people have with the RNA vaccines. And some people, it may work better in some groups than others too. That all has to be determined. But I think obviously worldwide, there's going to be a need for more good vaccines, and also the U.S. government through Operation Warp Speed paid a lot of money to these companies to develop vaccines, so they ought to deliver what they were asked to deliver. And right? And if it's just goodwill of the United States providing vaccine to the rest of the world, more power to us, right? This is how we get it over with.
Thank you, Dr. Cohen. Another community member asked, is it safe to do indoor gymnastics coaching and practice after being fully vaccinated?
I guess none of you county guys want to say anything about it. I think it probably is, depending on, right, if it's just a coach and a student, or not a big group. I think it would be safe. You know, I think you have to know that everyone is vaccinated. I think one of the issues that I think people had with the CDC guidance when it came out, as Nick had already pointed out, is that no one really had a good heads up on it. But when you walk into the grocery store now, and the grocery store doesn't require masking, right? At Trader Joe's, you don't have to wear a mask, at least outside of the state of California right now. And how do you know that the people who are not masked are all vaccinated? And as far as being a vaccinated person who's immune, it isn't going to cause you major problems, but it can start the cycle back up again of people getting infected. And I think that's where a lot of the conservatism has come in regarding masking, so we'll see how this all lays out. But I think if you're going to do gymnastics and you're going to do it indoors, I think you're going to want to know that everyone's vaccinated if you're going to do it without masks on.
I guess this question's around COVID testing. What type of tests, specifically around immunity antibodies?
Yeah, so there's an antibody test that specifically targets the spike protein, which is what all the vaccines are targeting. So there are other ones that target a different protein called an N protein, which is the primary response when people get natural infection. But you don't want to get that one because it's going to come up negative and you're going to think that the vaccine didn't work. So it has to be the spike protein.
And our last question was as a follow-up question from your previous comment about how about coaching little ones as a class where they're not vaccinated?
Yeah, well, that's a really interesting question. I think I would probably say that it would be the same guidance as with schools. And I will be interested to see how everyone lays that out. I don't have a good answer for that off the top. I think I don't think that coaching a gymnastics class is any different than having kids back in the classroom. And I think in those settings, I think the non-vaccinated people are still going to be asked to wear masks. But I don't know whether that's going to truly be the case.
Thank you.
Guys, does County have any comments about that?
No, I mean, I agree. I think it is challenging. And I think that depending on how little we're talking about, I mean, it's either a school or a daycare type of a scenario. One potential difference being, obviously in the school, we can set up furniture and keep everybody spaced apart a little bit better. And a gymnastics class, there might be some additional factors to consider. And forgive me, it's been a while since I've been to a gymnastics class, but I imagine there might also be some closer contact if you're assisting somebody in how to perform a particular tumble or something like that. So that might be, again, some increased contact that's taking place.
again, we think it seems like we have no more questions. We thank you everyone so much for attending our community forum. And I want to say thank you to our wonderful panelists and interpreters for tonight. We will see you in 2 weeks. We will upload this recording onto our Sac County website. So thank you. Have a good night, everyone.